Hello, good evening. This is Dr. Trudy of Snowspirations, and today we'll talk about a very important topic. Today we'll talk about jaundice. Jaundice is a very important topic in maternal and child health. So, without wasting time, let's talk about jaundice. So, what is actually jaundice? So, when you hear about jaundice, what does jaundice mean? So, jaundice is simply the yellow discoloration in a newborn baby's skin or the eyes. So when you hear about jaundice, it's not just the eyes that can have jaundice, the skin can also have jaundice. So yellow discoloration of the skin or the white part of the eyes, which we call the sclera. So this is a relatively common occurrence in newborns, especially if the newborns are born a little bit earlier than they should, if they are born before 38 weeks. The reason why we're using 38 weeks is because at 37 weeks, if a pregnancy is carried at 37 weeks, that pregnancy is classified as being term. That means the pregnancy is actually viable to have normal, outcome if the baby is born at that stage. So generally, most babies that are born before 38 weeks will present with this problem called jaundice. So this condition can actually be physiologic. By physiologic, it means it can actually be normal and expected. But the diagnosis of whether it's physiologic or abnormal is left for the doctor. So what leads to this jaundice? There's a very important structure in the red blood cell called bilirubin. So bilirubin is actually a structure that when the red blood cells are actually broken down, they can lead to this structure. So because the baby's developing liver, where everything is supposed to kind of go through, all the waste products from this blood is supposed to go through, this bilirubin is actually removed from the body through the liver. So because the baby's liver is still immature, it's not fully developed, the baby's liver will be overwhelmed with this bilirubin. So when the level of bilirubin is higher, it leads to this condition called jaundice. So bilirubin is a very important pigment, which is an end product of breakdown of red blood cells in the body of the baby. Like I mentioned, it can be physiologic, it can be normal, or it can be a sign that something is going on. Normally, in a newborn, this jaundice can be physiologic, and when it happens within the first, second, or third day of life, it's likely it's physiologic. It's likely it's not something you need to worry about. But here's the good news. Most treatments of jaundice in newborn babies are just for babies that actually have what we call pathologic jaundice. Majority of the jaundice we have in babies will be resolved without even going through any treatment. So just very few babies will actually go treatment, and the treatments are pretty much straightforward. Okay. However, it's important to note this. In as much as very few babies will develop complications from this jaundice, if bilirubin is left in the body of the baby for a long time, it can actually lead to damages. One of the areas where it can cause damages is the brain. It can damage the brain, and this is something you don't want to happen in a newborn baby, because the brain is a very sensitive organ that must develop properly. So, what are the symptoms of this jaundice? What are the key things that if you see, you will say, oh, this baby is jaundice? The very first one is the one that is obvious: yellowness of the skin, and also yellowness of the white part of the eye we call the sclera. And also in this baby, the babies are very irritable, they don't really sleep properly, they don't feed properly, and they also have brown colored urine. And some of them might have fever, some of them might have what we call high pitched cry, and some of them can actually vomit. So how do you check to see if the baby actually has jaundice, especially if the jaundice is in the skin? The one of the eyes can be very visible. So you can actually gently press the baby's forehead or the nose, gently. If the skin turns yellow when you press, it's likely your baby might have mild jaundice. But please, that's not the definitive way of knowing if your baby actually has high level of bilirubin in the body, which can lead to this condition. And please, when you're pressing the forehead of your baby, don't just go poking the forehead or the nose of your baby. Just be gentle. Just gentle application of pressure will tell if the baby's skin is prone to this jaundice. So what are the key points to note in jaundice? Most hospitals, most current advanced hospitals, they all have good policies of examining the baby of jaundice before the baby is discharged. So sometimes, if the hospital doesn't have that facility to examine the baby, if that baby develops jaundice that is pathologic and the baby is not properly taken care of, that baby might have some problems if the baby is discharged with this jaundice. So depending on where you are, depending on your location, it's recommended that these policies must be fully enforced. So like if you're in America, it's recommended that all newborn babies must be checked for jaundice routinely, at least every 8 to 12 hours while they're still in the hospital. Every 8 to 12 hours, we check for jaundice. So this is a great job. So when you're checking for something to prevent something, you're actually saving lives. So in America here, they actually have a proactive way of checking for jaundice. So your baby should be examined for jaundice between the third and the seventh day when the bilirubin level is still very high. So if your baby, for some reasons, is discharged earlier than 72 hours following childbirth, please make follow-up appointments to see your doctor to check for jaundice subsequently. Okay, so when are you supposed to be worried about this jaundice? What are the things you can see in your baby that will make you to start worrying to call your doctor? Like I mentioned, the obvious one is when your baby's color becomes more yellow. So if it's visibly yellow, if you look at the color of your baby's skin, it's not pink as it should, it's yellow, please call your doctor immediately. If your baby's skin looks yellow on the abdomen or the arms or the legs, so not just the nose and the face, if it's generally distributed, as a matter of fact, it's actually more problematic. So when you notice that the belly, the arms, and the legs are yellow, please call the provider immediately. I've already mentioned the eyes. Once you notice that the eyes are yellow, please call your doctor as soon as possible. If the baby is irritable, like very irritable, not tolerating feeds, and is crying high-pitched cry, please call your doctor as soon as possible. Don't even waste time. So like I mentioned, the major cause of jaundice is high level of this pigment called bilirubin. However, there are other things that can lead to jaundice. If the baby has internal bleeding in the brain, which we call hemorrhage, it can lead to this. If the baby has infection in the blood, which we call sepsis, it can lead to this. If the baby is exposed to any infection like bacterial infection, like viral infection, it can lead to this. Also, if the mother's blood group is not compatible with that of the father, it can lead to some incompatibilities, which can also lead to this. If there's any problem in the liver, any problem in the liver can also lead to this. Any problem in enzymes that helps the liver to remove bilirubin in the body can also lead to this. So anything whatsoever that affects the liver function can lead to this. Anything that affects the breakdown of red blood cells, so if the red blood cells are broken down more than they can be removed from the body, it can also lead to jaundice. So what are the risk factors of jaundice? So if a baby is born early, that baby is likely going to be prone to jaundice. So if the baby is born before 38 weeks, that baby is likely going to have more risk factor of having jaundice. If the baby had some injuries in course of delivery, also the baby might be prone to having this condition. If the blood group of the mother is not compatible with the father, like I mentioned, if the mother is negative and the father is positive, the mother can develop antibodies that can lead to this. If the baby is also breastfed, there's also some connectivity between jaundice and breastfeeding. Okay, there are also complications that can happen from this. Like I mentioned, if the level of the bilirubin is very high, it can lead to brain damage. So you need to be very careful when you see this yellow part of the eyes or yellow skin. Please call your doctor immediately. How do you diagnose this jaundice of a teen? I've already mentioned physical examination by a trained pediatrician who will look at the baby and make sure the baby is okay. They will do, or in some centers, they will do some skin tests to check the level of bilirubin in the body before they can commence treatment. So how do you treat, and what are the drugs you can use for jaundice? So treatment of jaundice is actually based on level. So if it's mild, if it's moderate, if it's severe, then some people can just, watchful waiting. Like I mentioned, if it's physiologic jaundice, it's definitely going to resolve on its own. You don't really need to do more. If it's more moderate, you can go for light therapy, which we call phototherapy, where the baby will be placed under special lighting to help remove the excess bilirubin in the body. Some babies might also need some medications we call immunoglobulins, which will put through the veins. Some babies can also need what we call exchange blood transfusion. So these are the few things you need to know about jaundice. Okay, so thank you for tuning in, and please like this video, please subscribe to this channel, and please share with your friends. Thank you for tuning in, and God bless you, and have a good evening. Bye-bye.